Welcome everyone to the training webinar series, Working with Protocols in Eyefinity Encompass presentation. Thank you for joining us today. We look forward to your questions throughout the presentation. You can enter them by clicking on the Q&A icon at the top of your screen. My name is Tara Brown, and it is my pleasure to be with you today to introduce Michelle Brocious. Michelle has over 20 years optical experience and has been an Eyefinity trainer for 18 years. She is a trainer at Eyefinity education conferences, on-sites, and hand-on sessions. Michelle is known for her compassion and kindness. She enjoys spending time with her family, grandchildren, and traveling. Go Hawkeyes. Welcome, Michelle.
All right, thank you, Tara. So we're gonna go ahead and get started. So let me stop sharing my screen for a second. And I will go ahead and let me know, Tara, if you can see my Eyefinity Encompass.
I can see it.
All right, perfect. And again, thank you for joining us for working with protocols. So I want to start with a little bit about what protocols are. Protocols are pre-configured templates for specific types of ocular exams. So what they do is they streamline documentation by pre-filling common exam elements. They're going to reduce repetitive actions like tapping or clicking through multiple fields, and also ensure consistency across similar types of exams. Now, a couple key points before you begin creating your protocols. One thing, you have to create them, right? And that's going to be done here in the browser by going to Preferences in the upper right-hand corner. And then you're going to choose Manage Protocols. So once you create these protocols, they can be used across multiple patient exams. Setting these up is similar to documenting an exam. So you want to definitely be very familiar with document your findings in the ocular exam room before you create these protocols. Okay. So you're going to see when you come in here, I do have some created. You do have some protocol options. The first thing I'm going to click on is add a protocol from template. We have some pre-built templates in here that you can start using, and they're just for basic common exams. We also have a couple, like a dilated and non-dilated, and that would indicate that type of exam. And everything's set within normal findings. So you can actually just select all, and you can add these in. And I'm not going to do that because I already got mine, so I'm going to cancel out of here. You have modify categories. Now, what this is you can create different categories for your protocols, okay? So what we basically recommend is like a refractive and a medical. Let me see what we got in here. We only, looks like we have one. So I'm going to put in here medical. And then I'm going to go ahead and choose add. And then I'll save that. So that just created a category, and where that category is going to fill out, if you look at these protocols here, you're going to see a category column where you can choose whether it's a refractive or a medical protocol. Okay. So to build a brand new protocol, actually, before we do that, I'm going to talk about some actions over on the right. You can manage a protocol. So for instance, if you notice this one is red, that means somebody edited this protocol. If I want to see what has been done, I can choose manage. And that's going to take me right into the ocular exam room. And this is indicating that somebody actually removed the quality 1, diabetes, hemoglobin, A1C, and also the communication from the provider. So if I want to go ahead and add that information in, I can choose OK. I can go down to the bottom of this protocol. So you'll see where it says diabetic retinopathy, OU. I have my counseling. I have a follow-up and an OCT. Well, I'm going to go ahead and resume my plan for the counseling. And then I could go ahead and add anything back in here that I need to. for the quality measures. And then once you're finished, you're going to say done in the bottom right, or you could just save and update any of the sticky fields in here, which is new. It's a really cool option. Anytime you see the green S, that means it's a sticky value. So if I take the verbiage out of here, I can add in whatever I want and it will stay. So I'm just going to say done. And then once you manage that protocol and make some edits, what you're going to do is in the upper left-hand corner, you're going to save that visit protocol. Now notice the red's gone because I made my edits and added in more information, and then it turned back into black. Okay. All right. So then the next thing is to add a protocol. And this is where we could put in a title. Okay. So you want this protocol title to be basically your diagnoses. So I can, let's add one. I'm going to do ocular hypertension. And I'm going to put OU. Okay. That protocol category that we entered in earlier, here's my medical. I'm going to add that in. You're going to see in here gender. This is required, but we actually do not use it. So it's recommended to leave it unfiltered unless it would be protocol gender specific. Then you have sharing options. So if you choose yes, you can share the protocol with all staff in your practice. Okay. Then when you select yes, you can choose who you would like to share it with. So you could choose specific doctors or specific staff members. Okay. And then once you're finished, you're going to go ahead and click save. And that's going to take us back into the ocular exam room. So for this protocol, this is where I'm going to build in my diagnoses and my plans. Okay. So I'm going to go ahead and I'm going to search for, if I don't have it listed up here, what I'd want to do is go down a little bit. And then you're going to see where it says find DX. That's where I could start typing in my ocular hypertension. And you'll see my ocular hypertension as my diagnoses. Now, when you're creating these protocols, what you don't want to do is select highly variable elements like specific measurements. So I'm not going to put any findings in here because the idea behind the protocols is to use is to record only common diagnoses and plans for that specific type of exam. Okay, so you will record the specifics of the findings when you're actually in your protocol on a per patient basis. Okay, so I am going to indicate a U by tapping the eyes, and then I'm going to look for my plans. Okay, so I'm going to counsel. So I'm going to look for counseling. So I'm going to counsel upper ocular hypertension. And again, feel free to put your own verbiage in these blocks. You have a couple options on the left-hand side. You have surgical options and you have a decision tab. So maybe I'm going to observe. I'm just going to check off that. You could put any medical decision-making information in any of these blocks and say done in the bottom right. The next plan that I want to do is I want to see them back. So I'm going to look for my follow-up. And then I could put my time frame. In this case, this is already in there. It's at 3 months. You could put something in here of, why you're seeing them back for the next visit. So I could check this. Somebody already updated ours and put information in. And I'll say done in the bottom right again. And then the last thing, maybe I'm going to do some photos. So I could start typing in fundus. And I could do my fundus photos. Okay. We could put our device here at the bottom where it says fundus photos device. We'll say it's an Optimap. You have the tabs on the left-hand side. So we got the vitreous, everything's normal throughout these tabs. And you want to keep it that way when building your protocol. So as I go through, you can see everything's normal. Assessment and plan, I'm going to leave that blank because you can do, again, that on a per patient basis. Same thing with billing. And I'm going to say done in the bottom right. So I'm going to scroll down and you can see what I just built in this protocol. So I have my diagnoses, my ocular hypertension, OU, my counseling, my follow-up, and my fundus. Okay. So I'm going to scroll back up at the top and I'm going to click in the upper left-hand corner and save this visit protocol. That's going to take us back to the protocol area. And I am going to go to the right and I'm going to show, I got about 25 in here, it looks like, or 14 actually. So you're going to see that we have that protocol now added in the system. Okay. Now, if for some reason, I needed to go in, oops, I forgot to put something in here, just go back into manage and you can resume any of the plans or the diagnoses to go ahead and update that protocol. Settings is just the name. When we created that protocol, if I click on settings, you'll just see that name. So if you want to change it to something else, make it anything that you call it in your office, you can. So that's what settings is for. Copy, you can copy one protocol to another, which is kind of nice because then you could just edit certain plans or whatever you may need. Saves you a little bit of time. And then you could delete one if you see you have multiple protocols for the same one. So I'm going to add another actually category because I did not see that refraction one in there. So I'm going to click back up and go to my modify categories again. And I am going to choose add another protocol. And I'm going to type in refractive. Add that back in. And then I will go ahead and add it. And looks like there's another one there. I don't think I could get rid of that one. We just put Michelle. And I'll add that one as well. And now I'll save. So none of these, for your refractive protocols have that category. So if you just want to add a category, again, go back to settings. And then now you're going to see the ones I added in and then save. Okay. So it'll, you will see medical and it's easier to search actually when you have them categorized. All right, we're going to create another one. So we're going to go to add protocol. And this time, let's create, I'm going to do POAG. So I'll do the primary open angle glaucoma, OU. We can also, maybe this one, we can put that this is actually a specific type of protocol. So, we want to may come back and change the name. I'm going to go ahead and add in my medical. I'm going to go ahead and share it and I'm going to save it. Again, that's going to take us in the ocular exam. And I'm going to search if it isn't listed here under my top 25, which it is actually. So I'm going to choose primary open angle glaucoma. So my stage isn't specified, but I can add in mild here, and then I could change the name of my protocol and put the mild stage. Okay. Then I'll go ahead and select the right and left eyes. And then I'm going to do my plans. So again, I'm always going to cancel. So I'm going to cancel POAG. Again, I'm going to leave this all as is and do everything else on a per patient basis. My follow-up. And I have 3 minutes in there. That's good for me. And I'll say done. And maybe, you know, I'm going to do an OCT. And I do this for every patient. I'm going to build that in. So I can select my OCT, optic nerve. Again, I'm going to leave everything as it is and done at the bottom. So as I scroll down again, you're going to see my primary open angle glaucoma, OU. I counseled, my follow-up's 3 months, and here's my optic nerve. So I'm going to go ahead and save that again. And then that one should be added in, okay? So I can go ahead and let me see, so you can see all these. So you'll see we have a couple refractive, or one refractive and a couple medical, okay? So there's a couple different ways that you can apply protocols within an exam. So to do that, what I'm going to do is bring up my patient for today. So I'm going to go up to my quick list, bring up my patient. I already started an exam for my patient, so I'm just going to click on November 17th on the blue hyperlink to bring up that exam. So I prepped this chart earlier. I did my chief complaint. I did my vision summary, okay? You'll notice I do not have an exam and I don't have an impressions and plans. Now, if you guys are aware, in the latest version of Eyefinity EHR, you could pull in your diagnosis and plans based off your manifest refraction. Super, super cool. So I can click add test to the right where it says vision exam. And I could hop into my refractions, MRX, CRX tab here. Or I can, you know, click on my vision exam up top, okay? I'm gonna go ahead and select it from the add test dropdown. So this is going to be my manifest. So I'm going to select my refraction type from the dropdown. When you choose that, you're going to see some additional buttons. So it's going to auto-generate your diagnoses, your counseling, and your follow-up. Saves you a ton of time. So this is only for refractive, okay? So I'm going to go ahead and put a prescription in here. I'm going to copy OD to OS, and I'm going to say 2020 for my visual acuities. Okay. And then I'm going to save in the bottom right. And then if I scroll down, you're going to see that this automatically documented my refractive diagnosis of myopia. Okay. It even associated it with astigmatism. Counseled. I have my 12 months in as my follow-up. And we also did a refraction, which is going to pull your 92015. Now, if I need to change something in here, because you'll see after counseling, we decided the patient is getting eyeglasses. Well, maybe they're getting contacts too. Because all you do is just click your resume button for that specific plan, and you can add information in, okay? So I could go to my contact lens options. I could go to treatment options, decision tab. I'm going to say they're getting contacts and glasses. Okay. And then done in the bottom right. And it just pulls that right in. So, like I said, based on your refractive diagnosis, this is in the latest version. Just by documenting your manifest, it's going to pull that in. Well, I don't have my exam in here yet, and maybe I have a couple other diagnoses for this patient. So up at the top on this overview screen, you'll see all the icons here. And the one we're going to click on is protocols. And I'm going to say this was a non-dilated exam with normal findings. Based on my exam, this patient also has dry eyes and maybe a little blepharitis. Okay. And then in the bottom right or up top, you're going to apply protocols. As you scroll down, you're going to see my examination. Okay. If I need to document something, I could actually go back into that simple eye exam. and I can add additional information. You're going to see now underneath myopia, we have blepharitis OU. Okay, it even put in the complexity, my ICD-10 expert. Now, depending on the severity, I might want to see them back. I could go ahead and resume the follow-up plan to the right there. And maybe I want to see them back in a week for this. I could select that time frame, choose done in the bottom right, and it's going to add that right in there for me. I counseled them, and maybe I'm not doing an OTC. You know, maybe I'm writing a prescription because it's a severe case. Okay, so I could just delete that plan out of there altogether. Takes it right out. Again, if I need to add a plan, you'll see on the diagnosis it says add plans. And I could start typing in the plan. So I'm going to type in prescription. I'm going to select prescription and save it. So you're going to see when you choose prescription, it says, please review and add additional plans. So I'm going to resume that prescription. I'm going to select what I'm giving my patient. If you don't see it listed here, you can just search, okay, and look for it under the drug name here. I'll just use the Tobrix. Okay, my SIG's already in there, my packaging's in there. So basically, I would just have to save this and then close out. Okay, so there's my prescription. My dry eye syndrome, that was another diagnosis that I selected. Again, it pulled it in. I don't want to see him back for dry eyes. I'm deleting that out of here. I counsel them, and I am doing over-the-counter regimen. So that's one way you can apply protocols, okay? You could do it right from this over screen like you do your simple eye exam and all your documentation. Now notice my RX is grayed out. I did not create my final from this manifest. So again, I could do it right here on the overview by choosing create final RX, add any additional information if needed, and save. Oops, forgot the usage. Okay, now if I scroll up a little bit, this is nice. It's all in the overview screen. Send RX, send fees over to Eyefinity Encompass. Okay. Previously, again, this has been in an update. It was under integration. So now when you are just on your overview screen, everything is right here. Okay. I could go ahead and send my prescription over to the pharmacy. Okay. I could go under document management and I could view faxes pending approval. Whoops, I'm in the wrong one. Sorry. RX tab, Michelle. There we go. And then you'll see that prescription I just wrote here. Just check the box and go ahead and e-prescribe selected. That would send it right over to the pharmacy. I'm going to bring my patient back up again. So when I'm ready to finalize this, I can go ahead and finalize this exam. Where did my exam go? Hold on one second. Well, let's go this way. There we go. So I brought it up this way. And again, I still have the option to finalize visit. So I can finalize my visit. I get my acknowledgement window that pops up and choose finalize note. Okay. And then it brings up that exam in a PDF format. You can actually print from here and print from your patient. All right, so I'm going to go back to this patient and I'm going to create another new visit. And then again, right from the overview screen, click protocols, select the protocols that you want to bring in. I'm going to say non-dilated, or maybe it's just a slit lamp. Just choose slit lamp. And we're going to say myopia. with glasses, or let's do with contacts. And then we'll say apply protocols in the bottom right. So that basically just brings my exam in and my diagnosis in my plans, okay? So again, you can pull this in through the manifest in the vision exam or through a protocol, okay? And then the other way, like I said, is if you go in the ocular exam itself by choosing that icon, you're gonna see a protocol tab up here. So you can choose protocols from here as well, or you can actually save and create a protocol from a visit if you don't have that protocol created. So again, I can click on this protocol right through here and choose that dry eye again and apply. Okay, so this save and create protocol, let's say you're doing an exam and you're like, oh, you know what? I want to actually create a protocol off this exam. You can do that, but remember those specific findings. Once you save it, you might want to edit it and then, take out those specific findings. Okay. All right, so I'm going to go down and see what we have in this one. And again, just like I did from the overview screen, if I don't want to see them back, just delete. You could do it from the ocular examiner overview. If I want to go ahead and add something in, just resume your plans. If I want to add an additional plan to the diagnoses, that's when I would resume the DX. I'm going to go back to the visit overview in the upper left there. And then I also want to show you in the help menu, if you get stuck when you're creating these, if you just type protocols in here and do your little search, we actually have building common protocols. This is really nice. So if you click on that hyperlink, it basically shows you what the exam protocols are. And then down here, it's going to show you, what you could name it, what your diagnosis is going to be, even some findings and assessments, and then the plan that you can use for these protocols. There's quite a few in here. I'll give you a little idea of how to set them up. Okay. We also have creating and editing, working with protocols that manage protocol categories where we put the refractive and medical in, and applying on the iPad. Okay. And there's some videos in here as well. All right. Tara, I'm going to go ahead and stop for a minute and see if we have any questions.
We don't have any questions. We had one question in regarding if the recording will be available. So I know there was several folks that joined later. So yes, the recording will be available, the on-demand link on the website, same place where you registered. Any other questions for Michelle? Go ahead and put them in the Q&A. No questions? Okay. Michelle, were you were completed? Okay, awesome. And we have looking for more training. Check out our other learning opportunities such as documentation, tutorials, walkthroughs, role-based training, webinars, one-on-one virtual and on-site training or consultation. You can learn more at eyefinity.com/education. And with that, I'd like to thank you, Michelle, for your time and valuable information you shared with us. And thank you all on the line for taking time out of your busy schedule to be with us today. This concludes our presentation.